Hello, I'm Charles, and welcome to my podcast. To start off my podcast, I want to begin with a story. It was a stressful car ride to the hospital. I was in unbearable pain, and everyone was silent except for the wind. It was howling as the car sped to the hospital. I was soaking in sweat from how nervous I was, and my stomach felt like millions of butterflies were fluttering around inside. I feared the unknown. I had no clue what was going on with me. I didn't know if I was going to die or if it was even something curable. Nor did I have any clue as to what they were going to do to me in the hospital. These thoughts of uncertainty just killed me inside. Finally, we had made it to the hospital. My dad slammed to a ruthless stop in the emergency parking area. In a matter of seconds, nurses came flooding out of the doors, giving commands to each other as they pushed a gurney towards us. It was dark outside, and on top of that, there was a cold drizzle. It felt like an action movie in the making. The nurses managed to help me climb onto the gurney and rushed me inside. A doctor quickly came to examine me. He listened to my heart, checked my pulse, checked my blood pressure, pressed on my hurting area, and asked me a few questions. After that, he went to the nurses' station and talked amongst his colleagues. I was worried that even he didn't know what was going on with me. As I was waiting on the doctor, other nurses were setting me up with an IV, dressing me in a gown, and hooked me up to a computer. The doctor came back and said I had an inguinal hernia, claiming that it wasn't fatal if they were quick to treat it, meaning I needed to undergo surgery. I was quickly prepped for surgery and placed on a different hospital bed, heading into surgery. Doors flew open, nurses were screaming, and I was more nervous than ever. We reached the operating room, and I was introduced to the doctors, who soon placed a mask on me and told me to breathe in. I was knocked out cold in a matter of seconds. When I woke up, I was in the worst pain I've ever felt before. My lower stomach felt like someone was stabbing me with a sharp knife multiple times. I was screaming at the top of my lungs. I couldn't control myself. The pain was unbearable. The nurses tried asking me where the pain was and how bad did it hurt, but I couldn't explain. Since the nurses knew I couldn't explain, they brought a poster with a pain chart rating 1 to 10. I pointed at the face rating 10 and pointed at my lower stomach, letting them understand what was going on. They grabbed the doctor and gave me medicine through my IV, relieving my pain. If it weren't for that poster of the pain chart, I wouldn't have been able to communicate properly with the medical staff. You may be wondering why I told you that long story, and I'll explain why in just a bit. But first, let me give you some insight on a problem our society faces today. Millions of people are suffering every day. They suffer primarily at the point of communication with medical professionals. Patients are just unable to clearly get their message across and understand what medical staff are trying to tell them. It's extremely important for there to be good communication between patients and the medical staff so that patients can receive the best care possible to ensure the safety of their health. Looking back at my story, I found that visual aid helped enhance the communication between myself and the medical staff. So my solution to the problem that I brought up earlier is that we incorporate visual aids in our healthcare. This will enhance the communication between patients and medical staff and clearly get information across between the two. Visual aids will help break down information for patients to understand and will give quick responses to medical staff and ultimately help fix this gap of the lack of communication between patients and medical staff. To get a better idea of how visual aids affect patients, I read multiple articles. The first article I read was titled Communicating Information to Patients: The Use of Cartoon Illustrations to Improve Comprehension of Instructions by Chris Delp and Jeffrey Jones, who are both medical doctors. In their article, they specifically look at how cartoon illustrations affect patients and how they're able to comprehend and their compliance. They conducted their study in Butterworth Hospital. The study, patients were randomly assigned to receive wound care instructions with or without cartoon illustrations, and then 3 days later, the patients were followed up by a telephone call. A blinded investigator would ask a series of questions designed to test the patient's recall of understanding and the compliance with the wound care instructions that they're given via the cartoon illustrations. Overall, they just wanted to show that cartoon illustrations are an effective strategy for conveying information and may improve patient compliance. In the second article, titled Communicating Health Risk with Visual Aids by Rocio Garcia, Rentemero, and Edward T. Coakley, they noticed how patients needed to be educated on health risks, so they claimed that using visual aids is a great way to inform patients. To prove that using visual aids helps inform patients, they conducted a study investigating the benefits of visual aids for communicating health risks to diverse, vulnerable people. The third article that I read was titled The Role of Pictures in Improving Health Communication, a review of research on attention, comprehension, recall, and adherence by Peter S. Hausta, Cecilia C. Dokub, Leonard G. Dokub, and Matthew J. Localzo. Much like the second this article acknowledges that communication between health professionals and patients is problematic. They also claim that using visual aids is a great method to help get information across to inform patients. They reviewed studies in health education, psychology, education, and marketing journals to see the effects of using visual aids to inform patients. From studying the articles, they realized that visual aids are a great way to inform patients. Don't get me wrong, these articles are great articles, but they lack a certain point of interest. They don't look at how visual aids affect Latinos in the Rio Grande Valley. Latinos in the Rio Grande Valley make up a big population. It makes your information faulty and unreliable. To help back up the earlier problem that I addressed, I conducted an experiment, and it takes into consideration the gap that the articles left. To help back up my solution and address the gap in the articles, I have created an experimental study. My experimental study was driven by one specific research question. That specific research question was, how do visual aids affect Latino patients in the Rio Grande Valley? I performed my experimental study on Juan Pablo Ruiz, a 16-year-old Latino from the Rio Grande Valley who attends early college high school. We sat down and I presented him 11 examples of visual aids used in the medical field. Then I asked him how he interpreted the visual aids. The question I asked him were like, did you understand the visual aid completely? What questions do you have / what did you understand? What interested you about the visual aid? Is there anything you would change about the visual aid to make it better? And on a scale of 1 to 10, 1 being easy to understand and 10 being difficult to understand, what would you rate it? I also asked, what was the main message trying to be conveyed? These questions helped me understand how Juan interpreted the visual aids, and if he was able to understand them. Overall, the process took about 30 minutes. What I gathered from the process was that Juan was better able to understand simple visual aids that had a lot of color and had very simple terminology. Overall, Juan was able to understand the visual aids. This leads me to presume that incorporating visual aids in our healthcare today will surely enhance the communication between patients and medical professionals. I do think that my research failed in which I only conducted the experiment on one person. The problem with conducting the experiment on one person is that it doesn't take into consideration all types of Latinos and Latinos that live in different areas of the valley either. Overall, the data I collected did somewhat answer my initial question of how do visual aids affect Latinos patients in the Rio Grande Valley. My research helped show that visual aids can be an easy way to communicate information between Latinos, patients, and medical professionals based on Juan responses. Assessing the data that I have now, I feel like the course of action to help fill in my gaps should be conducting a similar study, but studying more patients with different backgrounds and different walks of life to help strengthen the data on how visual aids affect Latinos in the Rio Grande Valley. Overall, judging from my data though, visual aids are an easy way to get information across between individuals. Visual aids that are worded simply and to the point, are colorful, and provide simple pictures are the best way to help enhance the communication between Latino patients and medical professionals. They ensure the safety of patients' health and end poor communication that leads to poor health care. Well, that concludes my podcast. Thank you for listening.